Welcome to Memorize Quickly. Today we are going to talk about pathognomonic signs. In simple terms, a pathognomonic sign is a medical signal or finding so characteristic and exclusive to a specific disease that, by itself, it allows for a diagnosis to be confirmed with absolute certainty.
They are a specific dental anomaly and a classic sign of late congenital syphilis. That is, syphilis that is transmitted from mother to baby during pregnancy or childbirth. They affect the permanent central incisors, the two upper front teeth, and have very distinctive characteristics. It is a golden to greenish or brown ring that forms around the iris, on the periphery of the cornea, due to the accumulation of copper in the eye. This finding is a characteristic sign of Wilson's disease. It is a yellowish plaque or deposit of fat, cholesterol, and lipids that forms beneath the skin's surface, specifically on the eyelids. Its appearance is related to high levels of cholesterol and triglycerides. Raccoon eyes are not a disease itself, but a clinical sign. The medical term is bilateral periorbital ecchymosis. It consists of the appearance of bruises or ecchymosis, accumulation of blood under the skin, around both eyes, giving the characteristic appearance of a raccoon. Their appearance following a head injury indicates a serious underlying trauma, a skull fracture, and requires immediate medical attention. A butterfly rash, or malar rash, is a red, butterfly-shaped rash that appears across the cheeks and bridge of the nose and is a common sign of lupus, an autoimmune disease. It often worsens with sun exposure and can be accompanied by other symptoms like fatigue and joint pain, but it can also be caused by other conditions such as rosacea, erysipelas, and pellagra. Koplik's spots are a pathognomonic, highly characteristic sign of measles, appearing as small bluish-white spots on a red background inside the cheeks, typically opposite the molars, just before the typical measles rash breaks out. These spots, named after Dr. Henry Koplik, who described them in 1896, are considered a crucial early indicator of measles infection, though they may be absent in some vaccinated individuals. Is a cancer that forms lesions or abnormal tissue on the skin, mucous membranes, lymph nodes, and internal organs, typically appearing as red, purple, or brown patches or bumps. It is caused by the human herpes virus 8, HHV8, and most often affects people with weakened immune systems, such as those with HIV/AIDS or organ transplant recipients. Erythema migrans is a distinctive skin rash and is the most characteristic and earliest clinical sign of Lyme disease. It appears at the site of the tick bite after the bacterium Borrelia burgdorferi has been transmitted. The Trousseau sign is an indicator of hypocalcemia, low calcium levels, observed as an involuntary carpopetal spasm, muscle contraction in the hand and wrist, triggered by inflating a blood pressure cuff around the arm. And we have Chvostek's sign is a clinical sign characterized by an involuntary twitch of the facial muscles after gently tapping the facial nerve just in front of the ear. This abnormal muscle contraction is an indicator of hypocalcemia, low blood calcium levels, a condition that causes nerve hyperexcitability and can lead to other symptoms of tetany, such as muscle spasms. Thanks for watching. To all doctors, medical students, and lifelong learners, if you found this helpful, please subscribe and share. The next video is Ciguatera fish poisoning.